Okay, well, welcome everyone to Care Answered, New York State Community Medicaid update. We've had a lot of these, and I imagine we'll continue to have them. There's always changes. My name is Nicole Christensen. I am the president of Care Answered, as well as a board certified patient advocate and the author of the book From Crisis to Calm. At Care Answered, our mission is to access the best care for all of our clients while giving their loved ones peace of mind and empowering all patients. And that's really a lot about what this webinar series are about, to basically inform and empower. So we're very excited to be able to bring this to you and record it as well. So I am going to get straight into it because we have lots to cover, as you can imagine. If you have any questions, feel free to put them in the chat. I will try to cover everything, all of your questions. And at the end, I will also give time, if we have time, to answer any questions. But of course, you guys can get in touch with me in whichever way you like. So let's get on with it. So I'm going to start with the good news. So I've actually had a lot of calls about this, but the 30-month look back, as far as I am aware, according to the Department of Health, which they informally said, is not going to start until 2025. It was scheduled to start many times in the past, and latest April 1st of this year, but it has been delayed. And I know that there's advocates on the policy level trying to delay it indefinitely. It is a hard thing to kind of figure out, I think, for the Department of Health and everybody involved in Medicaid in New York, because they're trying to figure out what the penalty will be. We know that there is a penalty or in their look back period for a nursing home, but that's much easier to calculate. So stay tuned, but informally it's delayed to 2025, which is good for all of us for many reasons. The look back makes it difficult, but it does tell us to prepare now. It also will make it more time consuming to be approved, even if everything is great and perfect and you've worked with Medicaid experts or elder law attorneys, they still have to go through that paperwork. So that delay does give us some time. So make use of it. The other thing that has increased recently, it actually was put onto paper in March rather than January, is that the income limits for community Medicaid have changed. So their increase for singles is 1732, sorry, that's 1732 a month. And for couples, it's 2351 a month. Again, these are the basic numbers. So those who are not as familiar with community Medicaid know that that's not a strict and hard line. So again, we work with the greatest Medicaid experts, as well as elder law attorneys, and so they can help you. So don't think of that number as set in stone. Also, there was a slight increase in asset limits, again, starting in March. So for singles, it's 31,175. For couples, it's 43,312. So again, this was put in place recently. Took place in March. Now, the other thing that is not financial is the New York Independent Assessment Program has postponed their reassessments and regular assessments. So that is a change that they keep on moving down the line. And it's apparently been postponed indefinitely. So what does that mean? When we get routinely assessed, which would be, if you're on community Medicaid, which would be annually, or you had a health decline, or there's some concerns that you may need more or less hours of care, you can still schedule them, but it will not be with the New York independent assessors. It will still be with your local DSS office or your MLTC. So that is what is going on as far as potential good news. The reason why that's good news, in my opinion, is because I don't believe, from what I've seen and heard and experienced, that really NYA has the staff to make that happen as frequently as it needs to. So this is a good thing, in my opinion. So qualifying for community Medicaid, most of this has been the same for quite a while. More recently, in the past few years, is that you need to be financially approved before you go to the steps of being financially approved. I mean, before you go on to the steps of being medically approved, you need to be financially approved first. So the general rule is you must need 120 plus days of assistance with activities of daily living, that's ADLs, to enroll in this long-term care, the community Medicaid. And that means, so if you break a hip and you're going to rehab, but you're expected to get better and be able to walk and be in less pain, that's not long-term, right? That's a shorter term need, but it's a long-term assistance with activities of daily living. Now, another thing that I want to talk about that comes up a lot is immediate need process. So for those that are unfamiliar, immediate need is just like it sounds. It's somebody that needs that care to start as soon as possible. There's a real medical need for it. I know from my colleagues, it's being, and those that I work with, it's being used a lot. However, the other thing that I've seen with it is there's been more pushback. With anything that we utilize as a tool, we need to use it correctly for the people that need it. Because if everybody's going to immediate need, then that system gets backed up as well. So that's just some information. It's not saying not to use immediate need, of course, but that's what I'm seeing. In actuality, as far as policy is concerned, they have 12 calendar days from the financial application of community Medicaid to the authorization of hours. That's 12 calendar days, not business days. Now, in reality, is that what we're seeing? No. Even for those who have been approved for immediate need, it's longer than that. So, working with an advocate to speed that process along can be helpful. The other thing is, if you are immediate need, sometimes families actually get caught off guard because they don't have everything situated for that immediacy. So just know that that's what's taking place. Also, starting in February of 2023, as I mentioned in other webinars, there's an authorization form. So that's really needed if you are speaking on behalf of your loved one. So if your loved one has a diagnosis of dementia, and so that call and that scheduling the appointments for these assessments, which we'll go into further in a moment, is they're not able to do, you really need to fill out this authorization form, which they have to sign, and you, as their authorized representative, need to sign as well, so that you can speak on their behalf, so that you can schedule these much needed assessment appointments. So do know that you do need to fill that out. I don't want it to waste any time for anybody that's going through that process, and we help you with that at Care Answered. And then it takes them a little while. I suggest you fax it in because mail takes a long time. So faxing it in, and it takes them a few days to process it, and then you can go right through and schedule your assessment appointments. Again, for those that don't know what I'm talking about, assessment appointments, I promise I'm going to tell you further in just a moment. And then there's the MLTC, the NYS assessments determine if you are approved medically for community Medicaid. And then there is selecting of a managed long-term care plan. They also do an evaluation, and they inform you, which is heavily, heavily based on those NYA assessments. Again, NYA is New York independent assessors, it's going to be heavily based on that information about how many hours you're going to receive. So there's really 3 assessments, which we'll talk about now. So NYA, again, is New York Independent Assessments. There's 2 assessments within NYA. One is a nurse assessment, which can take up to 3 hours. You can have them in person, or you can do them virtually, generally via Zoom. And then there is a clinical assessment. That takes, in my experience, up to an hour. And that's a clinician, a physician assistant, a nurse practitioner, or the like. And they ask fewer questions, basically to make sure that it's safe for you to be able to get that care in your home, which is fairly new idea. So those are the 2 assessments that you need. Care Answered prepares you for them and actually comes with you to them to advocate on your behalf. But it's really important that you know that these happen. And they are not, it says a clinical assessment. There is no touching, there's no blood pressure check, none of those things. It's really a series of questions and seeing how you're able to move. So people have different ideas about in-person or virtual, but that's what it is. It's questions. So they can see via camera what you can do, or they can be there in person. But again, that authorized representative, I strongly suggest, even if there's no diagnosis of dementia, that the loved one be there for those assessments. And again, if you can have an advocate there, even the better. Now there is a rule, though I have not seen it actually take place yet, that if during those NYA assessments, if it is determined that 12 hours or more are needed, it will go to an independent panel who will determine if it is safe for that person to remain in the community. I haven't seen that information from a panel. I've only experienced people that have been denied, and it doesn't say it's unsafe, but it has said that they were denied. The one circumstance that I do tell people to think about and definitely work with an advocate is if the person is on hospice. So legally and policy-wise, you should be able to have both, right? Because home hospice in particular is what I'm speaking about, doesn't give you a lot of hours of care, and you may need more hours of care. But in reality, how it's viewed, how they're interpreting the policy, oftentimes I find it better to be get the community Medicaid and then get the hospice rather than the other way around. So just a thing of note, again, working with an advocate, you can get all of that information that you need. And assessments are valid for 12 months now. Okay, so those NYA assessments are valid for 12 months. Okay, activities of daily living. I say this a lot because this program really focuses on that. There were supposed to be changes in how the NIO was going to assess, what they were going to look at. But as you can see, if you can see the screen, we're doing the same thing we've been doing for quite some time. So what they're looking at or looking closely at is activities of daily living, ambulating or moving around, whether that's a wheelchair, walking, what have you. Personal hygiene, which could be brushing teeth, brushing hair, things like that, dressing, eating, bathing, transferring, which is getting up, standing up from a sitting position and vice versa, and turning and positioning in bed, which means moving to the right or the left in your bed by your own capabilities, or do you need assistance? What they talked about a lot is requiring physical maneuvering with at least 3 of these ADLs. And they were actually a little bit different in ADLs. That has not been put into practice yet. So that if you didn't have a diagnosis of dementia, to be medically approved, you would need physical maneuvering of at least 3 ADLs. That is not in place, so I don't want to emphasize it too much. The other was that for those with dementia diagnosis, there would be a minimum of supervision with 2 ADLs. Again, none of these things are in process yet. So that was something that we were talking about. If everybody could mute themselves, that would be so helpful. Thank you. So other changes in community Medicaid process that has happened for a little while now is that the assessment system kind of takes the managed long-term care plans out of the process. So they're determining the amount of hours of care. So that's the third assessment that I was talking about. But they are really relying on what the NYS assessment says in their UAS system, which is basically just a software system, putting in common language, so that they see everything that the NYS assessors put in there. But like with anything, there are some nurses and MLTCs that are more thorough, and they'll put in all that information, and those that may not do it like that. They may really be relying directly on what the NYS assessors say. It has taken away your primary care physician, your community doctor, the people that really know you. It takes a lot of what they have to say out of the picture. At Care Answered, we make sure that that is heard. So we work with you, but it's harder for people doing it by themselves. And there is a form to allow your doctor to have input as well, and we can help you with that as well. So there's been a big push, and for financial reasons is what's commonly thought of, is for dual eligibility programs. So that means that people are covered under Medicaid and Medicare when they have community Medicaid. So Medicare is a federal program. I'm just putting it in I'm oversimplifying it, but Medicare is a federal program. Medicaid is a state program. So to save the state money, they would prefer if you had a Medicaid, Medicare program. So that may work for you, but know that there are different programs to choose. So these dual eligibility programs include PACE, which is a medical adult daycare where all services are on site by managed by an insurance provider. So it's one insurance program, and you get your medical assistance there, you get your adult daycare and activities, and it's all on one site. That's not your home, but you go to this site, which can be a great program for people. However, for a lot of people that have Medicare or have insurance through their former employer, that is, they may not be able to utilize their same doctors, right? Because they probably are not in that program, or they may not be in that program. So just something to know. The other one is called a MAP program, Medicare Advantage Plus. So it's generally when somebody has a Medicare Advantage plan, and the home care that's provided by Community Medicaid comes by those providers that are on their Medicare Advantage plan. So again, that can be really helpful for people as well, as long as everything falls into place. I have had the experience of that not working out well. So with anything, the sooner you have an advocate in place, the more we can do. But sometimes I get called for when people are considering community Medicaid. So Care Answer can do an assessment and determine if it's a great program for you by letting you know what, if you'd likely be approved medically, as well as going through how many hours you may get and what the program really means. Because there are other programs as well, which we'll talk about. But then there's sometimes that people are on community Medicaid and they're like, what just happened? And that often happens that they have been put on, or they're about to get on, a dual eligibility program, and they just heard that they're going to lose their potentially great insurance that they had with their previous employer. So you want to know what you're choosing. There could be a best option for you, but you need to know what all the options are to be able to make that choice. So just be mindful of that. And they're limiting MLTCs. That's been going on for the past 3 years as well. There are less MLTCs, managed long-term care providers. Okay, CDPAP stands for Consumer Directed Personal Assistance Program. Now, they don't have to inform potential Medicaid clients about this, but it seems as if everybody still knows about it. People like me get all the information out. Also, people that provide CDPAP, companies that provide CDPAP, are the financial conduit for CDPAP through Community Medicaid. They seem to be getting the word out. So I'm happy to know that people still are being made aware of it. What it is, for those that don't know, is that you can select who provides you the care. It doesn't have to be from a home care agency. It could be a loved one, a neighbor, somebody that you trust that provided great care for somebody else you know, things like that. And they can provide the care and get paid via Medicaid. There's still a process to it, but it is something that can be done. And it's not for everybody. It doesn't work for everybody. But again, knowing your options helps you to make that decision yourself and your loved ones to make that decision. MLTC lockdown, managed long-term care lockdown, that happened in 2020. And what that means is that when you are getting community Medicaid, you've selected your managed long-term care plan, and they've provided you the number of hours. And then you say, for whatever reason, maybe they're not listening, they're not providing a care provider, they have nobody to provide the aides. It could be a number of reasons that you don't feel like you're getting the service that you need from your managed long-term care provider. You can switch your MLTC within 90 days. After that 90 days, you cannot switch for another 9 months. So until your year comes up. So that was put into place in 2020. And they say, as you can see on the slide, with good cause only during the last 9 months. It's very, very, very hard to leave within those 9 months after the 3 months are up. But an example, and what we've advocated for, if they have nobody to provide the care and there's somebody else that does it, or something like that, that might be good cause, but it's not, I don't really like them. That won't be considered generally good cause. Now, as far as somebody that gets MLTC, if they're going to transfer to or from one of those dual programs that I mentioned, the PACE or the MAP, that you can do. You don't have to wait a year to change that. So what are the steps to take? Speak to an elder law special needs attorney on how to plan now. So if this is something that you can see in your future or the future of a loved one, it's now is the time to talk about it, not after we find out that there is going to be a 30-month look back. So really, it's now time to plan, work with Care Answered and the Medicaid specialists that we work with. We work with all the best because we want our clients to have the best service and the best care. There are also programs like the nursing home transition and diversion and the traumatic brain injury waiver programs, which we work with as well. We can help to find the best programs for you in your particular time of need. And to get an advocate to access the care that you need. There's lots of options. There's more options than you think, and there's more strategies to get the care you need than you might think. And sometimes somebody to hold your hand through that process and help your family through that process is what's going to make the difference between you getting the care you need and not. So we're going to be providing updates whenever available, and we'll continually update as we have, and because things are constantly changing, but certainly reach out to us. I know I am a New Yorker. I know I speak fast, so I'm trying to slow it down. But if you have any questions, you can take yourself off mute or put it in the chat and let me know. Oh, at what stage of the process, thank you, Annabelle, would one contact Care Answered? Really, and that's a great question. So one of the stages is, hey, is community Medicaid even going to be appropriate for care for my loved one or myself? So that's when we can come into contact. Sometimes elder law attorneys will call us when they have somebody that might be on the cusp and they want us to help them determine if it is a good option for them. The other time is, okay, I already feel like this is the way to go. And I've been financially approved, but now I'm going to need help with the medical approval because, as I said, it's a many-step process. So it definitely helps people to have an advocate there for the whole process. For us, we not only do the assessment, we help to coordinate letters with your doctors or clinicians. We attend the assessment so that we can advocate there. So it's a smoother process. So hold on. Okay.
Can I ask a follow-up?
Sure. Is that you, Annabelle?
Yeah. Hi.
Okay,
Thank
sure.
you very much. Thanks for the program and for answering my initial question.
Sure.
So, are you also what's considered a geriatric care manager? Like, would you come in and evaluate the client's needs before we even get started? I'm an elder law attorney. I get notified by people, well, we need an aide or nursing home care, we need the application done, and I can do the legal part of it, the transfers, the applications, uh but the rest of it I don't do, and I'm a small firm. So I was just wondering what gaps you or your company might be able to fill in.
Well, thank you for asking. Yes, we do all of that. We are board certified patient advocates, but in that process, just like geriatric care managers have their different specialties, but this is, yes, absolutely. This is our specialty from beginning to end. We work everybody through it so that we can get their best care and figure out what their needs are.
Well, thank you very much.
Thank you.
I'm sure I'll be in touch.
Okay, I look forward to it. And we have another question from Hop Queen. I might be saying that wrong, so correct me, please. Could you give the latest update regarding recertification of Medicaid? Can you put yourself off mute and tell me what you mean by that? Do you mean the care or the financial?
Can you hear me? You're okay?
I can.
Okay, good. Yeah, what happens is that my wife has already applied, she was accepted, but then now she has to
He's got to turn off one device. He's got two devices going.
Yeah, you're a little bit of echo, but
echo.
let me say what I think you're saying. You're saying that your wife was already approved, and now you're getting information that she needs to recertify and what that means.
Right.
So it sounds like it's recertification, financial recertification. So I work with Medicaid experts on the financial side. But I can tell you, I'll gloss it over for you. But definitely contact me and I'll put you in touch with some folks that can give you more assistance. Sometimes that recertification can be very annoying, but it's most of the documents that you put in the first place. So if you did it yourself or you worked with an attorney or a Medicaid specialist, sometimes that's a good person to go to. But as I said, the income limits have changed. So it may be that if she had, and again, I'm not asking you for the details, but if somebody has a pooled trust, and because the income limits have changed, maybe you need less money in your pooled trust. So you want to make sure that that is correct, but you definitely need to fill out that recertification so that you can continue to get Medicaid. But definitely we can talk offline about it too. Thank you for your question.
Yeah, because it's like you said, it's a little bit, I mean, it seems simple, but there's a lot of questions and sometimes you don't know where, especially when it comes to proving the income and the assets and the spouse refusal, that element becomes a little bit overwhelming as to exactly what is defined and what should be submitted and not submitted. You see, that's what I mean.
Yeah, absolutely, absolutely. And we can definitely help you with that. So we'll talk offline.
Good.
Okay, so Jamie, thank you for your question. Where can the authorization form for a family member or advocate be found, and where can one find the form that allows doctors to give Medicaid? So if you work with Care Answered, we can give that to you, but it is online. I don't even know because I have it in my general files where it is, but look it up under Medicaid and you could probably find it there. But definitely that authorization form needs to be filled out, as well as if you're trying to give the doctor's forms in, if you don't have an advocate to help you with that, that's another way you can get some of the doctor's information directly from your community doctor in. Okay. Let me see it. Looks like we have, you're welcome. Do we have any more questions? Those were the ones from chat. These are great questions, everybody. If you have any more questions, you can put it in chat or take yourself off mute. Okay, quick question. You could take yourself off mute. Probably be easier.
Hi, can you hear me?
I can.
Oh, hey. Um, there's been a lot lately, a lot of chatter about changes that are coming to CDPAP. And I was wondering if you could tell us a little bit more about that. I see a lot of people who are scared that they're going to lose the program. I see that they're going to be changing and putting it all into one fiscal intermediary potentially. But do you know of anything coming directly down the pipeline that's going to be affecting the CDPAP program?
Great question, Jamie. So yeah, there's a lot of chatter about a lot of things.
Yeah.
But I try not to give any information until it's official or it's mostly official. So yeah, I've heard that same chatter. There's always been chatter about CDPAP, about cutting it, about not making it eligible for people, about people taking advantage of it. So no, I don't know and what the latest thoughts are about. And also there's a lot of chatter about 24/7 care or split shift care and how is that able to happen. It's a little bit, the CDPAP, to be honest, is a little bit wild, wild west like, because the policies are not so clear and stated, but it can be such a lifesaver for some families. So, so I hope it's not going anywhere. And I know that there are advocates working hard on that. So I don't know what's going to happen, but right now, and also I mentioned before, there was in that kind of path, they were saying, okay, consumer directed personal assistance program, we're not going to tell anybody about it. We don't have to. They don't have to tell anybody about it at this point. So what will happen? I don't know. We'll see. It's not set in stone yet.
Thank you.
You're welcome. Great question. But don't worry, everybody. Once these things, I always have my eyes on what's happening. And there's so many great people in this field. I will definitely update you whenever I have more information about any of these things, because I know it affects all of us and our families. Any other questions? All right. Well, thank you everyone for being here, and I look forward to your additional questions and potentially working with each other and just helping each other and our families, our loved ones, our clients, getting through all the different stages of care and life. So have a wonderful spring, and we'll be in touch soon. Our next webinar is going to be excellent. I'm very excited about it. It's on May 15th, and it's going to be, which is mental health awareness And we're going to be speaking with Jamie Rosen, and it's how to navigate a mental health crisis. So we look forward to having you back then. Thanks so much, everyone.
Thank
Thanks,
you, Nicole.
Nicole.
Thank you.
Thank you.
Thank you, Nicole.
You're welcome.
Bye-bye.
Thank you.